Some of the warning signs can include headache, blurry vision, and right upper quadrant pain right here by the liver. Preeclampsia is a vascular disease of pregnancy. It's typically kind of described as high blood pressure and proteinuria, which is essentially protein in the urine. There's a lot of risk factors for preeclampsia. Truth be told, everybody's at risk. As far as the specific risk factors, older patients are at risk, IVF pregnancies are at risk, very young patients are also at risk, certain ethnicities, low socioeconomic status, and certain medical conditions such as chronic hypertension, diabetes. To be honest, the list goes on and on, so I think it's best just to make sure that we screen on a visit-by-visit basis, sometimes on a weekly basis, and make sure that we can catch it when it happens. Preeclampsia can be a very sudden onset. From one day your blood pressure is good to the next day it's sky high. And this is why sometimes, even seeing a doctor on a weekly basis may not be enough to catch it, which is why I'm a big proponent of home blood pressure monitoring. There's a few worrisome signs to look out for. Unfortunately, they can be pretty common in pregnancy, so it's kind of hard to differentiate. But some of the warning signs can include headache, blurry vision, and right upper quadrant pain right here by the liver. While these can be very common in pregnancy, things that differentiate it, essentially it's going to be the blood pressure. So when you have headaches with high blood pressure, it's a lot more worrisome than somebody with headaches and normal blood pressure. So the best thing to do when you're worried is get your blood pressure taken and just make sure that it's within the normal range. I think it's very important, once you get the diagnosis of preeclampsia, to figure out what's the management plan. So it very much depends on how far along in the pregnancy you are. So when you're term pregnancy, we just go ahead and send you to the hospital and get you delivered. And that way we don't take any risks of that harming the baby or the mother. But the problem comes in when it's early, when you have to kind of weigh the risks of prematurity with the risks of preeclampsia. This is where sometimes outpatient management of preeclampsia, mild preeclampsia, can be done, where a twice weekly basis you'll come into the office and test your blood pressure, test the urine, and check the baby to make sure everything's okay. On top of that, I usually like to send my patients home with a blood pressure cuff monitor, because even twice weekly might seem like a lot, but there's still a lot of time in between visits where things can go wrong. And once it goes wrong with preeclampsia, it just escalates out of control. And so testing your own blood pressure at home could be a way to catch it when it starts to get from mild to severe. They can be something as simple as swelling, but severe, such as heart attacks, strokes, pulmonary edema, and the one we're always looking out for, which is seizures. Postpartum preeclampsia is very common. Quite a few patients will present with high blood pressures after delivery. And so we continue to check blood pressures after delivery for 24 to 48 hours to make sure. And then if the patients go home and start to experience excess swelling that is beyond the norm, or headaches, blurry vision, and pain, it's best that they come in to get checked out, because it can occur quite frequently after the delivery. So there's lots of ways to kind of help out. The most obvious, of course, is going to be healthy living. So essentially eating healthy, stemming your weight gain in the pregnancy, considering cooking at home where there's less sodium in the food that we eat, as opposed to fast food that's usually pretty oily, greasy, and salty. Those things can elevate a person's blood pressure and putting them more at risk for preeclampsia.
If you like this video, please give it a thumbs up to help more people find this important health information. click the subscribe button and the notification bell for access and reminders to more Emanate Health videos. We upload informative video content every week.